So today we're discussing a case, which is not that uncommon, of a 64-year-old gentleman who has a long-standing history of hepatitis C, who presents to his primary care doctor with an episode of nausea, vomiting, ill feeling, and lightheadedness. On evaluation, his primary care doctor does an evaluation. His serum chemistries are notable for some liver dysfunction. He has a mildly elevated AST and ALT. His bilirubin is 2.1. His albumin is a little decreased at 3.3. His INR is 1.1, and he has no stigmata of end-stage liver disease, such as ascites or a history of encephalopathy. And he's never had any GI bleeding in the past. Given the condition of his liver disease, the patient undergoes imaging, and this reveals a 4-centimeter mass in the liver, at which time the patient is referred to either a hepatologist or oncologist for further evaluation and workup. I think there's some very important points to take away from this case. One is the diagnosis of hepatocellular carcinoma or liver cancer. We know that this patient is at risk for liver cancer. He has a long history of hepatitis C. Whether or not he'd been screened on a regular basis is an important fact to note. The fact that they're coming in the door with this degree of liver function and a 4-centimeter mass tells me that they probably were not screened, and we know that screening is important for patients with chronic liver disease because the best way to cure HCC, or really the only way to cure it, is to find it early. Even without being screened, this patient is found with a relatively early tumor. We learn that further staging studies do not indicate any evidence of vascular invasion in the liver. We also see that the patient has no disease outside the liver. At the end of the day, now we have a patient who has a 4-centimeter mass, and the question comes up, does he need a biopsy? We learned that his alpha-fetoprotein is elevated at 400 nanograms per ml. That by itself is not diagnostic of liver cancer, though obviously very suggestive. Really, the diagnosis of liver cancer can be made non-invasively with a triple-phase CT scan or a dynamic contrast MRI scan, which has very typical characteristics in a patient with chronic liver disease. That is to say, the lesion is hypervascular, has delayed washout, and in that setting we can say with fair confidence whether or not this is a liver cancer. And in this case, the patient does have those characteristics.